And good morning, everyone. Brand new edition of Sports Medicine Weekly here on The Score. My name is Steve Cashel, so happy to be joined by my co-host this week. It's Dr. Charles Bush-Joseph, long time, 16 years as the head team physician for the Chicago White Sox, also works for the Chicago Bulls. He's a sports medicine specialist, orthopedic surgeon from Midwest Orthopaedics at Rush, filling in this week for my usual co-host, Dr. Brian Cole. Our website is sportsmedicineweekly.com. Dr. Chuck, how are you this morning?
I'm great, Steve. Happy to be here.
Thanks so much. Want to start off with some news, sports injury-wise, from the NFL Combine. Always popular, getting more popular than ever now, the NFL Combine. Kenneth Murray, Patrick Queen, both projected first-round selections, injured while running the 40-yard dash at the NFL Combine. Both injured hamstrings at their second 40-yard attempt. Now, both injuries reportedly minor, but my question to you, Dr. Chuck, what is it about sprinting that might cause this mechanism of injury?
You know, hamstring injuries are relatively common in high-end athletes, especially early in the season. Now, I can't tell you how important the combine is in that 40 time for athletes. It means thousands, if not millions of dollars.
Sure.
And the difference between a 4.8 or 4.48 and a 4.52 is dramatic. So these athletes are always going to perform to their highest level and really give everything they got. What happens with a hamstring tear, I'm reaching further to make my stride longer and more aggressive than what I normally do, and it's a eccentric injury. Most injuries that we suffer in muscles are eccentric types, and more on that lengthening, where the muscle's lengthening as I'm striding or decelerating my arm after throwing a ball, as opposed to when I'm actually contracting or the muscle shortening. So, you know, these are common injuries. They're very difficult to deal with. We see them a lot where, you know, we're entering the spring soccer season. And if you look at our professional leagues, both in the NFL and Major League Soccer, and certainly even the English Premier League, 60% of hamstring injuries occur in the first 25% of the season.
Yeah, I was going to ask you then, is there any significance to the fact that it occurred for both these guys in the second 40-yard attempt for both athletes?
They're warmed up. That's when they're trying to run their best time on that second and third trial. And so, yeah, you know, they're going all out. It's a tough thing. And unfortunately, the severity of the hamstring strain and how bad the muscle's damage will determine how long the disability. Usually there's been several studies, both in Major League Baseball and in the NFL, where we're able to obtain MRIs on these injuries. And we can usually predict, based on the MRI appearance of the scan, as to how long that player will be out. And usually if there's significant damage throughout the entire muscle itself, we're talking an injury that's going to require months to recover, as opposed to clearly a minor strain.
Is a strain same thing as a tear? Is it always a tear?
You know, it is. And actually, it's a matter of definition. A grade 1 strain where the muscle's damaged a little bit, but fibers aren't really torn. A grade 2 where a few fibers are torn, but the majority of the muscle's still intact. Or a grade 3 where there's significant muscle tearing. Certainly, the greater the degree of injury, the longer the recovery, the more difficult, and the greater chance of recurrence. So hamstrings, we still say nowadays, is a better injury prevented than treated, because the greatest risk for a hamstring tear is a previous hamstring strain. And there's lots of new training techniques, and I would suggest all go on Google and look. There's a term we use called the Nordic curl, like from the North Scandinavia. Nordic curl is really the best exercise in preventing hamstring injuries. It's a difficult exercise to do, but if you can master it, you're going to dramatically lower that risk of injury.
Yeah, because obviously tear sounds a lot worse than strain, right?
A tear, and a significant or serious tear in a fine-tuned athlete like an NFL cornerback, can sometimes be career-threatening.
Let's move on.